Hey everybody, it's Dr. Sam, and I want to welcome you to my 200th show of my EyeClarity podcast. My goal is creating great value for you, answering your questions, giving you information on a research level, and also clinical pearls. So I just want to express my gratitude to you for following me, sending me comments and questions. And I hope I can give you more value as we move forward. So, thanks again for being part of the community, and I hope you enjoy this episode. Hello, everyone. It's Dr. Sam. I'd like to welcome you to my EyeClarity Podcast. This is a show that offers cutting edge information on how to improve your vision and overall wellness through holistic methods. I so appreciate you spending part of your day with me. If you have questions, you can send them to hello@drsambyrne.com. Now, to the latest EyeClarity episode. Hey everybody, it's Dr. Sam, and I want to welcome you to another EyeClarity podcast. We have a very special guest today. He's just a beautiful human being, very inspirational. His name is Dr. Dhruvin Patel. He's an optometrist, entrepreneur, encouraging a healthier relationship with technology in the digital age. And he received a grant from the City University in London, where he lives, and he's built this company called Ocushield, which is international, distributed. It's a medically related product, which we'll get into, but it helps protect people against a topic I talk a lot about, which is blue light coming off our screens and LED lights. So Dhruvin has been featured in Forbes, the Wall Street Journal, USA Today, selling over 150,000 plus Ocushield products in 70 countries. He was also on the UK's Shark Tank. That's very cool. So Dhruvin, I want to bring you on the program. And my first question to you is, how are you seeing blue light impacting us, our health, our sleep, our skin, our eyes? Give us an update.
Yeah, first of all, thanks so much for having me on the podcast, and what a wonderful intro there. But yeah, to answer your question, I mean, blue light now I'm so happy that it's coming now more into the mainstream because, as you said, it's affecting three key elements to our lives, which is sleep, eyes, and skin. And more recently, the skin element, which is also interesting because Unilever released some research in October last year, which said actually 30 hours of screen time causes an increase in skin inflammation by 40%, which is effectively reduction of elasticity of the skin, which is effectively early aging. So, with that, as well as the information we have on cumulative exposure to blue light causes visual stress, whether it's tired eyes, which then turn into headaches, as well as blue light suppressing melatonin, which affects our sleep. It's a growing problem, which now numerous industries are being aware of. And, it's where, what I do is perfectly placed to be a great intervention to help consumers who want to limit their exposure and live a healthier life. So it's a really good time now that there's a lot of people that are understanding the pain points around blue light.
Yeah, for sure. It's amazing that we spend so much time on our digital device from early morning to late in the evening. And this exposure, of course, our eyes, but what you bring up around the skin, like going to a tanning salon, but going there like for 12 hours, I mean, of course, it's obvious that it's going to affect us. So what are some tips that you can recommend for us as we do view our screens? I don't think it's going to get any less. What say you in terms of, how can it help?
Yeah, totally. I mean, there's some really easy things that we could be doing. And what I always say is, firstly, proximity is really important. So if we're looking at the contribution of blue light from screens, increasing the working distance of your screen from where you are is going to reduce its impact on all, your whole health. So what I always say is that arm's length away is the perfect distance for a screen, a handheld device, if you can reach, if you need to touch it. But that will reduce the efficacy of blue light reaching you, just because naturally it's further away, it's less impactful. So that's my first tip, proximity. Secondly is reducing the brightness. When we're on screens, we can control the display, reduce the brightness. You're reducing the source of blue light, which is then going to be impacting us less because of that action. So those are my 2 quick tips if you want to reduce your blue light exposure. And then further than that, we have other interventions which can help. If you don't want to increase the proximity or you don't want to reduce the brightness, you've got 2 other solutions which can limit blue light from screens. Firstly, you have a software solution. So there are softwares out there which are inbuilt into Apple devices, which are called, for example, Night Shift. And it might turn on for a lot of you in the evening. And it was made for the evening because, there was a lot more research showing that sleep was affected by blue light back when they released it in 2018. But as we now know, it's also affecting eyes and skin. But the problem I find with that solution is consumers like to enjoy what they're looking at. You and I'm sure, Dr. Byrne, that when we're looking at Netflix or anything in the evening or even emails during the day, we want the image to remain crystal clear. And the problem with software solutions is it turns everything an ugly orange tinge. And when it comes to healthcare innovations, compliance is always the most important part. If you're not going to use a solution like the software, then it's almost redundant.
I've used your products and I have found them to be really helpful. And my patients have also really benefited from them. Why are your products, Ocushield, better than others? How do you set yourself apart from your competitors?
Yeah, really good question. For us, because I'm an optometrist by myself for my profession, I really wanted to create products that consumers can feel the benefit from. And the way we do that is actually knowing the data. So when we look at the wavelengths of blue light, we look at which are the most impactful and which, blue light wavelengths peak. And what I mean by that is, for example, in the 400 to 450 nanometers, 410 nanometers is where the blue light spikes. And we selectively filter out most of the blue light at these wavelengths. But, by doing that, we maintain a crystal clear picture because we have clever filtering within our products. And, in our screen filters, we have it in 2 ways. We put a pigment within the glass itself, which is absorbing this blue light at different wavelengths. But then we also put on surface coatings on the back, which deflect the harshest blue light coming off. And, because we are eye care professionals, me, myself and the team, we've been able to really hone in on making the product as best as possible. And, what's important for us is also to give trust to consumers. So here in the UK, we've got our products registered with the MHRA, which is the Medicines and Healthcare Regulatory Agency. And what they do is they make sure a product does what it says, but it's also safe for the market. And, we're also FDA pending. So your FDA in the USA is equivalent of MHRA here in the UK. And it's not something that you have to do for our products, but we feel when we're making claims about health that we do need to register with the authorities and make sure that we follow those guidelines where, other manufacturers that are claiming to limit blue light with their products might not be following that same quality checks and making sure that their products are, adhering to medical standards. And that's really important for us because we're a healthcare brand, and we want to make sure that we follow that.
Yeah, so we're here talking with Dr. Dhruvin Patel. He's an optometrist, entrepreneur, founder of a company called Ocushield, which helps protect us against the damaging blue light. and we'll get his website and contact information in a few minutes. But Dhruvin, I want to ask you, what do you see in terms of the future, with things like virtual reality and, video games and, what are you seeing as we move into 2022 and beyond in terms of how you fit into being able to help us with our health and wellness?
Sure. Yeah, I think screens are becoming an integral part of our lives, and they have done in the pandemic. And as more people adopt other technologies, whether it's virtual reality headsets, which, I don't want to get started on that, because that is really close to your eyes, and, bright,
Yeah, it is.
screens, which, again, that's not being looked at. I mean, for now, I'd recommend people that are using virtual reality headsets to really reduce that time on there, because that is, the closest you can get to putting a source of blue light near their eyes. But I think as more people become aware of the dangers, I think we're going to be, as a world, what we're seeing now is we're seeing a push to sustainability and the world removing single-use plastics, because we're caring about the plastic usage. In the same way, what we're seeing now is we're learning to live a healthy life with technology, being less connected, not getting that dopamine release because we're getting a notification, but at the same time, we're going to be reducing our screen exposure because of the blue light. So there's lots of changes that are coming, and I think people that are already aware of it, it's great because they can be ahead of the curve and they're reducing the impact on their health. But it's that awareness which is growing, and I think that's the most important thing for consumers that use technology.
Yeah, I know. I've seen you've got a very active social media presence, and you've got great posts. You should look for Ocushield on Instagram or Facebook or LinkedIn. Really find your information to be so informative, and you're an educator. You're teaching us. You're not just selling a product, but you're actually creating a lot of value in educating us on, okay, how can we navigate this? Because it's so new. I mean, in the US, I still go to conferences and there are doctors that are skeptical that blue light is actually an issue. And it blows me away that we don't recognize as a profession how damaging the blue light is. I've seen more people with macular degeneration and cataracts and glaucoma and more inflammatory issues in the eyes. And then, of course, the sleep issue. And then we've got the young kids with the gamers doing a lot of things there that are really affecting, their learning and their attention. So I really applaud you for all the energy you're putting into your products. How can people find you, and how can they find the product?
Yeah, so just before I touch on that, Dr. Byrne, you mentioned an important point about the profession not being, okay with blue light. And, what people also need to understand, what patients and consumers need to understand, is a lot of the profession is always guided by clinical papers which have been done over a long period of time, and really funded by big organizations. And actually what people are looking for in our profession is, studies which can go over 20, 30 years, but actually devices haven't even been around for that long in terms of smartphones.
That's right.
Get that conclusive evidence when it comes to linking the two, they're waiting for something that's not here at the present. But what is here is epidemiological studies which already show through in vitro testing or cohort studies or looking at it on a molecular level that blue light is dangerous. So, connecting the two, it doesn't take a rocket scientist to know that actually we know in the future it's going to be a problem. So I think, it's just sharing that with the profession as well. And as you said, the more they learn about it and the more we can share to open their eyes in that sense, pun intended, it is going to be beneficial as well.
Well, you've written a very extensive blue light paper, one for the consumer and one for the professional. A lot of research went into it. And, folks, I recommend getting that paper if you can, because it'll really spotlight the research that is being done ongoing. And it's pretty definitive. You know, the French government came out with a study on the damaging effects of blue light. I quote that study all the time. And, you know, blue light is here to stay, and we need to be able to navigate it. Otherwise, we're gonna have a lot of problems. So how can they buy your product? How can they get in touch with your team? If they have questions, give us your contact info.
Yeah, no, certainly. So anyone who's listening can find us at ocushield.com, which is OCUSHIELD.com. Where, as you mentioned, where we are active on the social medias such as Instagram, Facebook, LinkedIn, which is Get Ocushield. So just put Get in front of that. And for your listeners as well, I'm putting out there now. You know, if you put Dr. Sam Burning as a coupon in the website, you'll get 20% off your purchase as well. So
Great.
That's my gift to you and your listeners.
Okay. Well, thank you. Wow, that's a surprise. I wasn't expecting that. Very, very generous. And we're going to have you on the Health Summit. I'm doing a Health Summit again. This is our second one, January 14th to 16th, 2022. And we've invited Ocushield to come and participate and educate us. So stay tuned for those announcements. But Dhruvin, I want to thank you for taking the time in talking with me today. And I look forward to our future collaborations. I feel we have a great future together. So thank you for everything you're doing, and look forward to seeing you.
Totally. Yeah. Looking forward to working on some content for making people use technology better and improving their lives. Yeah. Thank you so much for having me.
Thank you for listening. I hope you learned something from the EyeClarity Podcast show today. If you enjoyed the episode, make sure to subscribe on iTunes or Spotify and leave a review. See you here next time.